Welcome back, everybody. Now, medical advances and insurance plans to help cover the cost of treatments are the focus today. Now, we've invited Martha Clopin from Get to Insurance back for a chat. Martha, thank you for being here. You had a very busy week. Let's start off by talking to everybody about the conference that you attended in Maui.
Yes, and thank you so much for inviting me to be here. I enjoy being with you so much, but I was on Maui for a conference. I co-authored a paper with a medical student. Her name is Miss Victoria Wu. She was incredible, but her mentor, Dr. Sherwood McClellan III, reached out to me and said, let's do a research paper about how insurance covers breast cancer.
Oh, okay. You know, we're gonna talk about you know, your co-author in just a second, but I want to know a little bit more about, you know, what are some common costs associated with the treatment?
Yes, some of the common costs are associated with, of course, you have to have a mammogram and a biopsy, and sometimes radiation is required. But we reached out to the National Comprehensive Cancer Center. We did a profile of a 66-year-old who is eligible for Medicare, and we looked at the coverage codes and about what those costs would be for the different services that you have when you're diagnosed with stage 1 breast cancer.
Okay. And then obviously this is talked about in that paper that you co-authored with Victoria. Tell us what it was like, you know, co-authoring with Victoria. How was that?
It was amazing because she's in Ohio and so is her mentor. So we did all of this with telephone calls and Zoom over a 6-month period.
Wow.
Because this is a peer-reviewed paper.
Okay.
And that means all the other doctors get to look at it and say, that doesn't make sense. So we have to really justify every single thing that we do. It's actually a model. So we looked at different insurance plans and how they would cover stage 1 breast cancer and what the cost would be.
Okay, interesting. You know, you also talked about diagnosis. What is the average age, you know, for diagnosis?
Yes, the average age is 62, and that's why it's so important to understand insurance, because sometimes people are retiring around that age and you might lose employer coverage. So that was why we did the study. We wanted to make sure people understand what would you pay based on the type of coverage you have.
Got it. Let's talk about, you know, the survival rate. You know, what is the survival rate of newly diagnosed patients with stage 1 breast cancer? You brought that up.
I'm so excited about that. I was not aware that the survival rates have improved greatly, over 90%, and after 5 years, 99%. And breast cancer is a very, very common diagnosis among women in the 60s.
Wow.
Yeah.
You know, you said you worked with Victoria over the past 6 months. Is that what it was?
Yes.
Is there anything else that stood out to you that you kind of learned while researching with her?
Well, it was so interesting. I learned that a lot of doctors have no idea how much these costs are for the patient. So by informing the doctors, it was hundreds and hundreds of doctors at this 105th Radium Society conference over on Maui. So by informing them, they can, you know, just make available to their patients all kinds of treatment that will, you know, improve the survival rate, because they don't have to worry that health insurance out of pocket is so expensive, because the costs have come down. The important thing is early diagnosis. So it's very important for people to stay on top of it and make sure they're going for their annual checkups. And if they do start to have some symptoms, just get right into your doctor, because it's no longer what it was. High survival rates, not as expensive to treat as it was in the past.
Okay, so that's the biggest tip that you have for our viewers out there, is get an early diagnosis as soon as you can.
Exactly.
The biggest tip. And if anybody wanted to learn more about Get to Insurance, or if they even had questions for you, what's a good website that they should log on to?
GetToInsurance.com. They can reach out to us there. We have our contact number, but I love talking to people, and I love just helping them with any health insurance question they may have. It's just so rewarding.
Of course. Well, on behalf of everybody watching, we love what you're doing for the community. Keep it up, and we can't wait to talk to you again soon.
Thank you so much.
Thanks, Martha. And everybody, we'll have more information on KHON2.com, including a wrap-up of this segment right here.